Hi viewers, welcome back. In today's video, we are going to discuss about hyperemesis gravidarum. Okay, so what is emesis? Emesis is vomiting. Okay, so hyperemesis, so vomiting which is abnormal, which is more than the normal. Okay, so hyperemesis gravidarum is a woman who is having severe vomiting which is going to deteriorate the life of the mother, as well as it is going to cause some negative impact on the baby. At that time you term it as hyperemesis gravidarum. Okay, so in today's class we will deal about this hyperemesis gravidarum in detail. So first, the etiological factors. Okay, so in which cases there is frequent reporting of hyperemesis. Okay, so most of the time hyperemesis is present with first pregnancy, that is like the first pregnancy there is more chances of getting hyperemesis, because like most of the time it is like psychological, they have not adjusted with the family environment, they are not that much mature to face a pregnancy, so because of that it happens. So sometimes it is because it is happening in the first pregnancy, and most probably it is in the first trimester. Okay, so that is first trimester in this sense. Already I have said you, see, until the placenta is taking up the role of maintaining the fetus circulation, till that time your hormones are playing the role of taking care of the fetus. So now your hormones play a major role to continue with the pregnancy or to sustain the pregnancy. So what happens? There is an increased hormonal secretion which is abnormal for the body. So at that time there is hyperemesis. So this hyperemesis stays only to the early weeks, that is like till 12 weeks it happens, and after that it will come down like once the role is taken up by the placenta, vomiting comes down. Okay, so usually this is happening in the first pregnancy and in the first trimester. And then comes the family history. Okay, so most of the time what happens, they give a history that my mother also had this type of vomiting, my sister had this type of vomiting, all these histories they come around. Okay, so it is a family or hereditary character that they have hyperemesis in their family running. And then multiple pregnancies or hydatidiform mode. Multiple pregnancy. See, already when we discussed about multiple pregnancy, I have said you, when the hormones are secreted for a singleton pregnancy, the body is able to tolerate. So when the hormones are excessive, so in multiple pregnancy you have 2 fetus, 3 fetus. So at that time what happens? There is an excessive hormone where there is an increased amount of progesterone which is getting secreted. So what happens is, these hormones play a major role in inducing vomiting. So naturally the woman may have hyperemesis or in some conditions of hydatidiform mole. Okay, hydatidiform mole we will discuss that in detail. Now I will tell you, hydatidiform mole is like a congenital anomaly. Okay, so where you will have like grape like cyst will be present and it is not a pregnancy, you do not have a sac. Okay, so in that condition you will have abnormal amount of hormone secreted, so which is going to induce vomiting, so which is going to cause hyperemesis. Okay, and then unplanned pregnancy. So already I said, like sometimes the mother is not ready to receive the pregnancy, so at that time it happens. Sometimes it is in like adolescent pregnancy, even like with adults, like where they have not planned for a pregnancy, in that condition also hyperemesis happens. So this is the etiological factors when we consider the hyperemesis gravidarum. Next we come to the theories why hyperemesis gravidarum takes place. Okay, so the first theory proposed is the hormonal theory. So already like what explanation I gave you is like you will have enough amount of hormones, that is like progesterone which is secreted more which is very new for the mother. So at that time there is a sensation of vomiting and she feels like hyperemesis, and that happens. And then the second theory is psychogenic. Psychogenic is like when the early morning she vomits, then it is like psychologically she fixes up in her mind that like her day is going to continue with vomiting. So naturally the woman will have continuous vomiting throughout the day. Okay, so that is like psychogenic. Sometimes when a mother is having hyperemesis gravidarum, usually what we suggest is we tell them, you give a change of atmosphere, that is like change the environment. Either like you can go in for hospitalization if needed, or otherwise you can just change the environment. Send her to the mother's home, or send her to the sister's home, send her like take her for a outing, maybe for 1 or 2 days. So a change of environment will bring a lot of difference in the health condition of the mother, where hyperemesis will get corrected. Okay, so that also you can try. And the next theory is the dietary deficiencies. So when there is vitamin deficiencies like vitamin B1 and B6, which can induce vomiting, so in that condition also there is hyperemesis gravidarum. And then the next condition is allergic. So sometimes what happens when the consumption begins, there are some allergic chemicals which are secreted by the ovum. Okay, so when there is some allergic reaction, that may cause hyperemesis. And the last factor is the immunological factor. So when you consider the immunological factors, it is like a cycle. Okay, so the woman vomits, her abdomen is empty, then what happens? Then ketone bodies are produced as there is a breakdown of protein. So when there is a ketone, the end products is ketone, and when there is ketone bodies, like again she will have vomiting. So this vomiting again induces vomiting. So this is like a cycle. Okay, so these are the 5 proposed theories where there is a logic of hyperemesis gravidarum. Sometimes your examiners may ask you what are the theories behind this hyperemesis gravidarum. So you must be able to explain. And then we come to the signs and symptoms of hyperemesis gravidarum. Okay, so see, emesis, your vomiting is present in normal pregnancy. Okay, so that doesn't matter, it will come down slowly, it is not going to cause any negative impact on the mother as well as on the child. But in hyperemesis there is going to be problem with the mother as well as on the child. Okay, so you have to be careful with the signs and symptoms of hyperemesis. So first let us discuss the symptoms. So symptoms is vomiting. First symptom, vomiting. Vomiting in the sense literally vomiting, full time vomiting from morning till night. Okay, so whatever she is consuming, water, food, maybe sometimes fruits, whatever she is eating, she will be vomiting. Okay, so increased amount of vomiting. And then comes the decreased urine, as like she is vomiting everything, there is no adequate perfusion to the kidney. So what happens? There is decreased urinary output. So decreased urinary output, there will be dark colored urine with decreased amount of urine. And then comes constipation. So naturally, so how I said there is nothing to get excreted through the urine, similarly you will not have any fibers, you will not have end products from the bowel also. So it will land up with constipation. So these are the symptoms with the fatigue. So mother complains of tiredness. So you can just imagine you vomit for one time, how much you feel tired. Similarly, when the mother is vomiting from morning till evening, think about the condition of the mother where she will have very tired and sick feel. Okay, so she will be sleeping most of the time in the day. So next comes the gastric pain. So gastric pain is because like when the woman is vomiting continuously, what happens? There will be severe regurgitation and the acid contents are coming out. So because of that, what happens? There will be severe gastritis in the like esophageal tract. So what happens? She will have severe epigastric pain. Okay, so these are the symptoms most of the time the mother complains. So signs, what we have to assess. Signs are some things like what we are going to assess with the mother. So when we are going to assess, first you are going to assess the loss of the weight. So actually in the beginning I would have said you like when we have discussed the diagnosis of pregnancy, definitely in the first trimester the mother is going to lose weight. Okay, that is because of normal vomiting. So she will have a mild amount of vomiting, she will have mild amount of nausea where she will not be having adequate food, and there will be mild loss of weight. But here what is happening? There is severe loss of weight because there is no oral food intake as well as fluid intake. So you have to think there is lot of weight loss for the mother. And then the anxious look. So when you look at the mother, you don't get that healthy feeling. The mother, you don't see that the mother is looking healthy. She is having a lot of anxiety, tension and stress. Okay, so that which is exhibited in her look. So she will be having an anxious look. And then followed by the physical examination. When you assess, you can see the eyes of the mother, it is like sunken eyes because of dehydration. And when you come to the tongue, it will be coated tongue. You will be able to see that yellow color coating over the tongue, which indicates that the mother is having severe vomiting. And then teeth. So when you assess the teeth of the mother, you will be able to see that yellow color coating, that is sods, you can see over the teeth of the thing. And breath, when you assess the breath of the mother, you will get that ketone smell, you will be able to feel. So there is a ketone breath present with the mother. And when we are coming to the vital signs assessment, like temperature, because of continuous vomiting, she will be having decrease in body temperature, pulse rate is going to increase, like tachycardia is present, BP will come down because like there is inadequate fluid, like she is vomiting and fluid intake is not taken up. So what happens, there will be decrease in the BP level. So you will have lot of changes with your vital signs. And then coming to the neurological examination, she will be restless, apathetic, tired, anxious, all these things will be present. And like there are some complications with your hyperemesis gravidarum. So when you are going to have such complications of Wernicke's encephalopathy or Korsakoff's sign, at that time what happens, like you will be able to identify with your neurological examination. So that we will discuss in the complication area. So then confirmation of pregnancy by a PV. So you are able to see that mother is vomiting continuously. So what you have to do is, like, you can confirm the diagnosis by doing a parvaginal examination. You do a PV and you find out whether really there is a pregnancy or not. So with that you can confirm it is a pregnancy or not. So these are the signs and symptoms of hyperemesis gravidarum. And then coming to the investigations, you go in for an urine analysis to rule out, I said the urine specific gravity is going to be low, amount is going to be low, and the color of the urine is going to be high. All these things you can assess with the urine analysis. And then biochemical assessment, you can see the potassium losses, sodium losses, as she is like vomiting continuous, electrolyte losses will be there. And then ophthalmic examination, sometimes like what happens, like retinal damage would have been taken place because of continuous vomiting, that also you can assess, and you can go in for an ECG evaluation to rule out the cardiovascular changes. Okay, so that is with the investigations. And then coming to the diagnosis, you have to assess the vital signs of the mother with the biochemical assessment. So everything together you conclude and tell the mother is diagnosed as hyperemesis gravidarum. Okay, then is the complication. So already I said, like, you have three major complications. One is Wernicke's encephalopathy, then is the peripheral neuritis, and then Korsakoff psychosis. So these three are the major complications which is present in hyperemesis gravidarum. So in Wernicke's encephalopathy, it is like you will be able to see the neurological changes which is present with the mother. That is like the mother becomes very anxious. She will not have any orientation, so that is like disorientation, and like loss of memory will be present, and she may not cooperate with you. all these things. Sometimes like she may even land up with coma. Okay, so that is with your vernix encephalopathy. When you come to the peripheral neuritis, it is like all your neurons are getting damaged and you will be having peripheral neuritis. And then we have Korsakoff psychosis, like where this is the next stage after mental confusion of vernix encephalopathy. Once the patient is having mental like vernix encephalopathy, the conditions become little more severe. So what happens, they go in for temporary loss of memory. Okay, so they are not able to remember the recent events. Okay, so that happens, and these are the three major complications of your hyperemesis gravidarum. Then we come to the management part. So management part, the first thing is hospitalization. As soon as you identify or confirm it is hyperemesis gravidarum, you can take the mother for a hospitalization, so that you can give adequate fluids and drugs like which can hold the condition of the mother in good. And then comes the fluid. So fluid administration, because like there is no oral intake, like because whatever she is taking in, everything she is going to vomit. So you can administer adequate amount of fluid. So usually you will have two big bore needles, like both the hands, like for continuous administration of fluids. And then drugs, like when you come to the drugs of the mother, so you can start with antihistamines. So usually it is to provide psychological support to the mother. You provide adequate sedation so that let her sleep and let her relax, so that she will be like all those like when we read about the theories, we have seen that psychological factor plays a major role. So adequately sedate the mother so that like she is like little more relaxed and stable. And then when we come to the antiemetic drugs, like you can give drugs to stop vomiting, so that can also help. And then vitamins, like I said, like when there is a vitamin deficiency of vitamin B1 and B6, at that time also there is vomiting, so you can give adequate vitamin supplementations. Then hydrocot. So hydrocot, when you have decreased BP, when the BP is very low and it doesn't pick up, so at that time you can go in for hydrocot administration. Okay. And then coming to the nurse's role, what role does we take up? So when as a nurse, so what you are supposed to provide the patient. So first is the intake and output chart. So you have a sharp intake and output chart. So like because the mother is going to vomit continuously and you don't know whether she is having dehydration, how much is the severity and all those things. So a continuous observation of the intake and output has to be done. Then that includes your urine amount, color, all those things also must be done together. Then we have your TPR chart, so where you will be assessing the vital charts very clearly, because I said like there is going to be lot of changes with your temperature, pulse and respiration. So this have to be keenly noted and charted. And then the weight of the mother. So at the time of admission, so daily you can check the weight of the mother to see whether she is having any progress in her condition. Then coming to the diet, so see to that, give soothing diet. Like maybe in the first few days, like where like maybe for the first 24 hours you will not be providing any oral diet. Then after that, like once the vomiting gets settled, you can start with oral food. Give food like which is more appetizing, which is more attractable, easily digestible, and try to avoid oil, spicy, fast food, all these things you can avoid. Okay, so that it helps like easily digestible foods can be provided. So then finally we come to the termination of pregnancy. Okay, so when you want to terminate a pregnancy, when do you do that? Okay, so usually when you see the mother's condition is becoming very bad. Okay, so when the condition is very much deteriorating, she is not having any improvement in her condition, that is like her vital signs are not picking up, so intake and output is very low, so urinary output is very less, dark colored urine, you are able to see the complications like your vernix encephalopathy and Korsakoff psychosis, all those things you are able to see. So at that time, like there is no other go, you have to terminate the pregnancy. Okay, so when you want to terminate pregnancy, it is in two areas of termination. So where you can go in for termination before 12 weeks and after 12. If you are going to terminate before 12 weeks, it is suction evacuation you can perform. So you can do a slow dilatation of the cervix by a laminarian tent, followed by rapid dilatation and evacuation you can be doing. So that will be like, it doesn't complicate the mother, she will be very well. Okay, so in case if you want to do it like after 12 weeks, then the choice is your hysterotomy. Your suction is not going to work out, and sometimes there may be bits remaining, so that can also lead to complications. So it is the termination of pregnancy before 12 weeks and after 12 weeks. Okay, so you have understood the topic of hyperemesis gravidarum. So where we have discussed in detail of etiological factors, your signs and symptoms, the diagnosis, the management part, the hospitalization part, and the nurse's role. Hope you understood the class. In case if you have any doubts, kindly go and ask your doubts in the comment box, so that let me clarify your doubts. Okay, bye, take care.